Hello and welcome to Homeopathy Simply Explained. I'm Petra Merker, an alternative practitioner for classical homeopathy in Darmstadt, and in today's video we have the seminar on the pandemic, again with the fourth part, Post Vac. As already mentioned in the last part of the seminar, post-COVID and post-vac are often lumped together. However, we see that these two clinical pictures differ from each other in homeopathic treatment, because with post-COVID and post-vac, different groups of medicines are used, which we will take a closer look at later. In the first parts of the seminar, we talked about COVID cases that were caused by an infection. In today's part of the seminar, we want to look at cases that are suspected of being related to the vaccination. I have split the part about the post-vac suspected cases as well as the parts about the infections. In the first part today, I will discuss cases in detail that I have already presented in the video Side Effect Bleeding, which I will link to you below the video. Of course, we will again discuss the homeopathic medicines and how to find medicines in detail. If you would like to support my work, you can find my PayPal account linked under the video. Before we get into the topic, let's take a quick look at the overview of what awaits you today. We talk about a case with mesenteric vein thrombosis and salivary gland necrosis, briefly discuss medical confidentiality, look at what the PI found out about the spike protein at the time, and discuss how microthrombosis can be detected other than through blood counts. We'll then take a quick look at what happened with the AstraZeneka vaccination and then come to the last case with bleeding from the urinary bladder, which then developed thrombosis. We'll start with my neighbor's case because it enabled me to later help my mother adequately. Our neighbor was over 80 years old, which is why he was one of the first to receive the mRNA vaccination from BioNTech. Bleeding occurred 4 days after the second vaccination. Our neighbors called me for advice after the neighbor was home from the hospital because they wanted the hospital discharge report explained to them. This is how I learned for the first time that symptoms could probably arise from the new administrations because our neighbor linked these symptoms to these. Our neighbor said that the clinic couldn't get his bleeding under control. He was still vomiting blood and also bleeding from the intestine. An old wound that was actually already crusted over kept breaking open and bleeding. He had never had such symptoms before. I explained the hospital letter to the elderly couple and went back home, but continued to follow the case even though I did not have him under homeopathic treatment. Over the next few days, the neighbor had to go back to the clinic due to severe bleeding. This time he didn't come home, he died. The neighbor's wife called me again to have the hospital report explained to her. The neighbor was suffering from mesenteric vein thrombosis, so the dead section of intestine had to be surgically removed. After the operation, the neighbor got worse and worse. Due to salivary gland necrosis, he no longer produced saliva and could no longer swallow. The neighbor died after a short time in the hospital. Recently learned from a similar case, the mother of a patient who was also vaccinated with BioNTech developed chronic diarrhea that became so severe that she could no longer hold stool. She then collapsed unconscious on the toilet. When the emergency doctor arrived, the elderly woman was responsive again and was even able to get into the ambulance on her own with help. In the hospital, there was massive bleeding in the gastrointestinal tract that could not be stopped. so that the patient's mother died of internal bleeding within a short time. In this context, I would like to address an important topic that everyone should be informed about. After her mother's death, the patient wanted to be given the hospital letter. The family doctor, to whom the patient has previously seen twice due to her mother's complaints, refused to allow her to do so. For some time now, a change in the law has been made due to multiple lawsuits filed against doctors. Medical confidentiality now applies beyond death. Anyone who wants their relatives to be informed about the cause of death after their own death and also have access to the patient file must record this in writing. But now back to the topic of the seminar. The Paul-Ehrlich Institute wrote in a publication in March 2021 that the spike protein is very fusion active and even in homeopathic doses causes the cells to fuse and thus die. I'll quote from the article. Measuring what connects tissue damage from cell fusion in COVID-19 and the role of the spike protein. The coronavirus, SARS-CoV-2, enters human cells through membrane fusion after its spike protein comes into contact with the ACE2 receptor. New studies show a second role of the protein in COVID-19, fusion to gather body cells. A research team at the Paul-Ehrlich Institute has developed promising assays that can be used to measure these membrane fusions. In cell culture, even the smallest amounts of the spike protein are enough to cause infected and uninfected cells to fuse and die. Virus particles with spike protein on their surface can even cause cells to fuse with their neighbors just through contact. eScience reports on the results in its online edition from February 9th, 2021. End of quote. This happens in the endothelial cells, the cells with which the blood vessels are lined. Bleeding and thrombosis can occur, as I already reported in a video. Let's repertorize the bleeding symptoms. I took the headings: stomach, vomiting, type of blood, rectum, hemorrhage from anus, general wounds bleeding freely, general wounds heal tendency to slowly, general thrombosis, general bleeding passive. In the differential diagnosis, we see three homeopathic medicines, all blood remedies such as Carbo vegetabilis, Crotalus horridus, and Hamamelis. Let's take a closer look at Carbo vegetabilis, Crotalus horridus, and Hamamelis in the differential picture. In homeopathy, Carbo vegetabilis is made from the charcoal of beech or birch wood. In conventional medicine, Carbo vegetabilis is also known as activated carbon, which is able to bind various substances thanks to this large pore surface. Activated carbon binds chlorine, ozone, bacteria and their toxins, chemical liquids and toxins from the air. Activated charcoal is used in humans to bind toxins from the digestive tract. It prevents toxins from being absorbed into the bloodstream. In high doses, activated charcoal can cause vomiting, constipation, or in the worst case, intestinal obstruction. In the homeopathic medicine picture, we see a lack of oxygen supply with decompensation of the tissues. The venous circulation and the hair vessels are particularly affected. The blood congeals, causing it to turn blue. When bleeding occurs, it is almost black and oozes, slowly over hours or days. The body becomes cold and blue. This cold is an important differential diagnosis for cecale cornutum, as we will see later. Bacteria can take over and patients can also bleed from their eyes. Crotalus horridus, the wood rattlesnake, is native to North America. Their poison leads to tissue destruction with pain and nausea. If the bite is left untreated, it can be fatal. In the homeopathic medicine picture, we see the blood, the heart and the liver as the primarily affected organs. Disorganization and disintegration of blood and tissue occurs, the tissue decomposing rapidly. This is also a slow bleeding, the so-called oozing bleeding. The blood is also dark and almost black. In both Crotalus horridus cases and Carbo vegetabilis cases, increased D-dimers can occur, a blood clotting protein that is increased when thrombosis forms. Often, no obvious thrombosis can be found in Post Vac patients because in some cases they are microthromboses that can be diagnosed using capillary microscopy of the finger or optical coherence tomography of the eye. Thrombosis in unusual places such as the brain, spleen, liver or abdominal cavity can also occur. I recently had an appointment with my ophthalmologist who now has to check for signs of microthrombosis in the eye because she has seen, quote, bad things, especially after the vaccination, end of quote. In fact, I have two people I know who had microthrombosis after vaccination and are now being treated conventionally. In the next part, I will present such a case which I assisted with homeopathy. The eye nerves can also be damaged by a corona infection, so it is recommended that everyone have their eyes checked. But let's get back to the differential diagnosis of the drugs regarding the neighbor with the mesenteric vein thrombosis. Witch hazel, the witch hazel plant, has a homeostatic, anti-inflammatory, astringent effect and relieves itching. Witch hazel is used for minor skin injuries, local inflammation of the skin and mucous membranes, hemorrhoids and varicose veins. Witch hazel causes venous congestion, bleeding, varicose veins and hemorrhoids. It attacks the vessels walls of the veins, causing venous passive bleeding. In the drug picture, we are dealing with open painful wounds. Weakness may occur after blood loss or after surgery. Witch hazel absorbs intraocular hemorrhages. The neighbor was clearly a Crotalus horridus case. I cannot judge whether this could have saved him from dying. January 29, 2021, the AstraZeneka vaccine was approved in the EU. The Standing Vaccination Commission only recommended the vaccine for people up to the age of 64 due to a lack of test data vaccination effectiveness in older people. It turned out that younger people in particular can develop sinus vein thrombosis due to the AstraZeneka vaccine, which is why the federal government decided on April 2, 2021 to only receive AstraZeneka vaccines for people aged 60 and over, so that this group of people can be vaccinated more quickly. My mother decided to get vaccinated with AstraZeneka. After the first vaccination, my mother developed a terrible headache. My mother described the headache as if her head was bursting. Based on my knowledge, I gave my mother Crotalus horridus, which quickly helped her. In Germany, AstraZeneca could only be ordered until the end of November 2021 because it was withdrawn from the market. The Paul-Ehrlich Institute issued a red-hand letter on AstraZeneka in May 2021, and injured parties began to file lawsuits. In a later blood test, I found elevated D-dimers in my mother's blood. After the laboratory informed me of the results by telephone, I consulted with a doctor friend who shared my opinion about the need for action. I sent my mother with the findings to an emergency medical service where she was prescribed high-dose aspirin and was told to see her family doctor. Homeopathically, I had my mother take Crotalus horridus frequently, even if she had no symptoms. The family doctor wrote a referral to a specialist who came to the conclusion that the elevated D-dimers were not that serious. As a result, my mother repeatedly needed the homeopathic medicine Crotalus horridus due to headaches. Without the neighbor's case, I would never have come up with this medicine for my mother and therefore would not have been able to help her preventively. Come to a case involving a woman who had bleeding from her bladder 3 days after the second vaccination with the BioNTech vaccine on June 11, 2021. The patient had a high temperature in the evening, she had pressure in her bladder, and when she went to the toilet, blood clots came out with the urine. She didn't have any pain like usual with a bladder infection, just pressure on her bladder. The patient went to the family doctor and told him her complaints and that she suspected that they were related to the vaccination because she was vaccinated 4 days ago. The family doctor listened to this but didn't even examine the urine or take a blood sample and said it had nothing to do with the vaccination. The patient should take antibiotics because it is a normal bladder infection. He gave her a sick note for work, which as usual had the ICD-10K for the diagnosis on it. It said T88.1. When she got home, the patient went online, searched for this abbreviation and found the following: 88.1 complication after vaccination. Shocked and irritated, the patient came to my practice on June 14, 2021, after hearing this story and told me about her experiences. The question now was whether she should take the antibiotic or not. The urine test that was then carried out naturally showed blood in the urine. It also contained proteins, which means the kidneys don't filter as well, and leukocytes were also included, which indicates inflammation. So there were no bacteria in the urine. The patient had this blood urine, cold feet, pressing bladder, pain, frequent urge to urinate, bloody clots in the urine, and back pain during the fever. I first prescribed 2 homeopathic medicines to the patient, which did not improve the symptoms. The next day, the patient made an appointment with a urologist to hear his opinion again. Like me, the urologist came to the conclusion that the patient should not take the antibiotic because he couldn't find anything abnormal during the sonography. He referred the patient for a CT scan. Since it took about a week until this appointment, he advised the patient to go to the hospital if the bleeding got worse. I repertorized again on June 16, 2021 to find the right homeopathic remedy. The symptoms now became a little more pronounced, so I had more starting points. A lot of blood clots came out of the bladder, especially in the morning. The patient had cramp-like pain. She felt the clots moving through the urethra. After getting up, the pressing pain started and lasted for 2-3 hours. Cramp-like pain in the bladder and urethra occurred during urination, just before the first drops of urine came and during urination. The bleeding only starts half an hour after waking up. Let's look at the repertorization of this. Urine bloody clots, generals morning, bladder pain urination before, urethra pain urination before, bladder pain cramping, bladder pain pressing pain, urethra pain clots of blood passing from. Found an interesting article about Cantaris in the World and I'll quote from it. The poison of the Spanish fly brings pleasure and death. Cantaridine, a component of the Spanish fly, is actually a strong poison. Among other things, it irritates the urinary tract, which can cause an erection. However, it does not increase sexual desire. But if the libido is there, it can give men a long love-making session or a painful permanent erection. Liver poisoning, circulatory collapse and kidney failure. Unfortunately, the Spanish fly is easily overdosed. Even 30 milligrams are fatal. The small death of orgasm can easily be followed by a big death due to cantaridine. Chemically speaking, this weapon is a so-called monoterpene and is related to substances in wormwood, dill and camphor. Cantaridine easily attaches itself to enzymes in the body that regulate two important biochemical steps known as phosphorylation and dephosphorylation. Both switch the form and function of many different proteins like toggle switches. The enzyme blockade causes blisters to form on the skin and tissue to die. It triggers life-threatening inflammation in the kidneys, and the liver is burned when breaking down the poison. Ancient Greece death sentences were therefore carried out with the Spanish fly. End of quote. Phosphorylation takes place in the mitochondria. Here the energy molecule ADP, adenosine diphosphate, with 2 phosphates is produced into ATP, adenosine triphosphate, with 3 phosphates, using oxygen. ATP is reduced in some patients with ME/CFS, Post Vac or post-COVID. The cells need ATP for various metabolic processes. The homeopathic medicine Cantaris attacks the urinary organs. In the inflammation leads to repeat destruction of tissues. The mucous membranes, serous membranes are particularly affected. So I prescribed the patient 1 globule of Cantaris XM 4 times a day. The patient continued to bleed until 3 p.m., after which the nightmare stopped. There was no longer any bleeding, pain or urge to urinate. Proteins were still present until June 24, 2021 and the leukocytes until July 26, 2021. Since a ureter could not be seen clearly during the CT examination and the findings could not be classified correctly, the patient was referred to a hospital for a urinary tract endoscopy. Another 2 weeks passed before this date. Since the urethra was to be mirrored, this had to be carried out in an inpatient setting under general anesthesia. The mirror examination revealed no findings. The patient naturally had enormous psychological stress during the entire waiting period because she was afraid that the examinations would reveal a cancer diagnosis. Inflammation developed on the left hand where a vein access had been made for the ureteroscopy. The vein became thick and extended into the elbow. The patient had to take off her watch because she couldn't tolerate the pressure on the vein. According to the orthopedist she went to, it was a thrombosis. Here too I supported the patient with a homeopathic medicine. Let's look at the repertorization of this. General swelling veins of, generals inflammation blood vessels, generals injuries ailments from chronic, generals pressure aggravates. The patient received carbo vegetabilis C30 3 times a day, a globe which quickly eliminated the pain, but the hardening remained for a while. In December 2021, the patient had boosters. Unfortunately, this was the last contact with the patient. I hope you got added value from the seminar. If you like it, I would be happy about a thumbs up. Subscribe to the channel and don't forget to activate the bell. See you soon. Goodbye.